Like many developed countries around the world, the citizens of Singapore can expect to enjoy a high life expectancy. However, these added years are driving a dramatic demographic shift. According to the World Health Organization, globally, by 2030, the number of people 60 and older will hit 1.4 billion, and by 2050, it will be a staggering 2.1 billion. Digital enablement and technologies can empower an aging population to thrive by improving access to quality care. SenzeHub develops vital signs wearables that provide early warning detection of condition deterioration to provide care before a situation is critical. George, we're all trying to find ways to help our parents live a happier, healthier life later in age. What was your motivation for starting SenzeHub?
It all started when my dad was hospitalized about 3 years ago, and we saw nurses actually taking vital signs manually, writing it on a piece of paper, and walking back to the station to key it into a laptop. A group of us got together and said that let's do it a bit more productively, and we developed and designed a wearable that actually takes vital signs and transmit it automatically in the background to a dashboard.
And from the vitals you're monitoring today to what you're looking at monitoring down the road, and what additional tech are you going to add to the SenzeHub wearable?
One of the things that we love to do is that with enough data over a period of time, be able to forecast 24 hours, 48 hours that someone may be looking at either a stroke or even a heart attack.
But you're not only developing your own hardware, you're also building a wellness platform. How do you think about that for SenzeHub's future?
Yeah, so it's actually quite different from the Apple and the Garmins and the Fitbits of the world. They generally would be monitoring oneself when you're out exercising, and they're generally supposed to be healthy. What we are looking at is a very different segment where the seniors themselves could be alone at home and no one knows their health condition.
How are you driving adoption for SenzeHub?
Getting the seniors themselves to adopt new technology can be rather challenging. Some of them may not even have a mobile device, believe it or not, but the actual customers will be the children, the family, the relatives who actually get peace of mind from being able to check on their mobile phone that dad is okay today or he may need some help.
So it starts with the family members that are keen to help older people, and then they're pushing their parents to adopt
Correct.
it.
Because I think the older folks need some convincing and influencing. So our go-to-market strategy is to talk to those who actually are caring for their parents, and rather than trying to sell it to the seniors themselves who may not have the money for it in the first place.
It's a big challenge to build your own hardware from scratch, as you did with SenzeHub. Startups rarely make the attempt to build new hardware from scratch. Can you talk about how that evolved for SenzeHub, and why did you decide to go down that otherwise risky road?
Some of the things that we wanted to do can't be bought off the shelf. So some of the off-the-shelf consumer wearables, you can't really use it in a hospital because every wearable would need its own handphone device to be paired with it, and getting it to transmit to the same database for alerts and dashboard is near impossible. So we started from scratch. Fortunately, we had early founders that actually are very experienced in the whole embedded system space, but we did have to go through the whole process of coming up with the PCB, fabricating it, and even doing the form factor and the plastic.
There seems to be so much opportunity to improve the quality of life of elderly patients and improve healthcare outcomes in the same process. So is there an opportunity for healthcare payers, insurance companies, and the healthcare systems to be buying SenzeHub and deploying it?
Yes and no. I think there is a lot of opportunity, but where insurance is concerned, they may not be that keen to pay for a new wearable device that's relatively unknown. So we have to actually look at more the family and members and the relatives who are willing to pay for something like this to have peace of mind, both for the seniors themselves, that someone is keeping an eye on them, a technology that's unseen in the background, and also for the loved ones themselves.